Psychiatry, right? Psychiatry. What do we know about this subject? Have you done this in the university? Yes or no? Yahani, was it one of the subjects in your university? Yes. Have you done it in which year did you do that? 5th year. Okay. Okay. You have done it in 5th year. And it's one of the major subjects in state medical faculties, Colombo, Peradeniya, whatever it is. It's one of the final year subjects like surgery, like medicine, like gynops, like pediatrics, right? So it's one of the major subjects, right? It's one of the major subjects. However, I don't know why it was not introduced to ERPM until now, right? Now it is introduced. So in Sri Lanka universities, it is tested in as a written exam plus a Viva exam. Written is you have to do MCQs and single best answer, right? MCQs and single best answer. And then we have a clinical component as well, where we examine psychiatric patients, right? But if you are talking about ERPM, what we have is only a written exam or theory exam. How do they test this theory? How do they test this theory? It's with MCQs, right? So we do not have essay when it comes to psychiatry. Is that a happy news to begin with? Are we happy that we don't have essay? Yes. It's all about MCQs, right? MCQs. How many MCQs? 30 MCQs will be there. And this is a part of ERPM Part A. You know, up to date, Part A was pediatrics, medicine, surgery, and gynops. Now you get psychiatry as well. So that's the 5th subject of ERPM Part A. And then we have Part B. Part B is Viva exam, where we have to examine and take history from children. That is pediatrics Viva, surgery, medicine, and gynops Viva. So if you put those 4 Viva together, that becomes ERPM Part B. And then we have ERPM Part C, where we test, right? Where we test emergencies of surgery, emergencies of medicine, emergencies of pediatrics, and emergencies of gynops. So that is called ERPM Part C. And then ERPM Part D, that is where we talk about gynops, ComMed and forensic, right? So Part D will not change. Part C will not change. Part B will not change. Only change is in Part A. Part A is 4 subjects. From now onwards, there will be 5 subjects. What is the importance of learning this subject? Number one, if we fail this subject, we will not be able to complete ERPM, so that we are not eligible to go for internship. Intern and bad. Even now, there are enough and more students who have qualified everything else, but failed forensic medicine, so they can't go for internship. What is the delay? Minimum of 6 months. We'll have to wait until next exam comes, right? And then any other subject, say community medicine. If you fail community medicine, even if you pass all the clinical components, we will not be able to go for internship because we have not completed ERPM. ERPM complete karan nathuwa dostara wenna bෑ, right? So that's it. Now from now onwards, it's psychiatry as well, right? So that's how it goes. Now we have, if you are seriously doing exam this time, like theory students, right? Theory students. Now for you, we have nearly 1.5 months to finish this brand new subject. Within 1.5 months, we have to finish whole syllabus psychiatry, plus we'll have to do some questions as well, right? We'll have to do some questions as well. Otherwise, what happens is you will see psychiatry appearing in your admission card, but we do not know anything about psychiatry. So we will just go, right? And we might fail, right? We might fail. So if we fail, what happens? There is a chance, not there is a chance, there's 100% chance that we will not get internship company in hand. So that's the problem, right? And this is a very easy subject as long as we learn it in a proper way, right? As long as we learn it in a proper way, this is going to be one of the easiest subjects, right? This is going to be one of the easiest subjects. So we'll take it positive. We'll take it positive. So to begin with, we will have some case discussion, right? We'll have some case discussion and tell me what you think as the diagnosis of some of these conditions, right? So I will share this screen. Right. Okay. Now, what do we see in this slide? So you can see, dear somebody, this is one of the emails sent by Sri Lanka Medical Council. As per decision of the council, the candidates of ERPM Part A were informed by the notice announced on 1st of April 2019 on SLMC website that psychiatry would be conducted as a separate paper 5 of ERPM from 1st of April 2021. Message is very clear, right? 1st of April 2021. Further, I wish to bring you a notice that the curriculum of psychiatry was not changed, right? And then if we see what this previous notice is, it's this, right? It's this, right? So important notice. This was sent in 2019. This was sent in 2019, right? Signed by acting registrar then of SLMC, and psychiatry is going to be the 5th subject, right? Psychiatry is going to be the 5th subject. So it's all official, right? It's all official, right? Remember, the good thing is passing this subject is easy, provided that we start liking this subject. You will start to like this subject anyway, right? Now, compared to any other subject, what is unique about psychiatry? What is unique about psychiatry? Yahani? Sorry, you are appearing in the screen, so I might ask questions, right? I don't know whether you are going to log off, right? Okay, Takshila, what is unique? What is unique? Now, medicine, you know, what are the subjects, what are the topics that we learn in medicine? Did your medicine teachers talk about myocardial infarction, heart attack? Yes or no? Fasan? Yes, you have got, you have learned heart attacks, right? But have you ever got a heart attack? No, we have not got. Diabetes, have you got diabetes? We have not got. We are learning about imaginary patients so that we might not feel it very well. Pediatrics, we talk about developmental delay. Have we got developmental delay? We have not got personally. Cerebral palsy, no. Gynops, ectopic pregnancy. Your teacher will be talking, but have we got? We have not got. That we have not got. And then surgery, your surgeon will talk about hernia. Do you have it? You might not have. Some of you might have. Some of you might have. Esophageal cancer, have you got that? No. Dysphagia, your surgical teacher will say it's very difficult to eat and drink when you have esophageal cancer. But do we have that feeling? We have never got that, thankfully. But when it comes to psychiatry, most of the conditions that we are discussing in this topic, this subject, we all have that, more or less. More or less. Dilka, do you believe that we have psychiatric conditions? Yeah. Yes, we all have, right? We all have. Let's check whether we have any of those. Tell me whether you have this. Tell me whether you have this. Right. So what is this? A 20-year-old medical student feels tired always and does not like to enjoy with her friends and has no appetite. No appetite. He doesn't feel like eating. She thinks that it's not worth living. It's not worth living. Pasan, have you ever felt that? Have you ever felt that? Are you always tired? You may be a little different than this age, so 20 years of age, right? Do you feel tired? Do you feel tired? Doesn't enjoy. Sometimes we feel no point of going with friends, right? I don't want to eat. And this is enough. This is enough. I want to end my life. Atime jivatuna. Right? Mata enjoy karan donit ne. Right? Mata enjoy karan donit ne. So this life is so horrible, cruel world. Harima napuru lokya. Have you ever felt that? Yes or not? We all have felt that. Right? We all have felt that. Now, what is this girl having? What is this girl having? What do you think as this girl having? Any comments? Yes. What is this girl having? Yes. Yes. Very good. Everybody is thinking that it is depression. Some of you think that it is mild depression. Some of us think that it is severe depression. Right? Fine. Right. So we'll forget about whether it is mild or moderate or severe or whatever. Right? But is it really depression? Is it really depression? Yes. Is it really depression? Varna, is this girl having depression? Do you believe? Yes. Have you ever got this? We all have got that. So did we have depression then? Yes. Apita depression tibunal? Yes or no? If you had depression, somebody may have given antidepressants to you. Did you get that? Depression, antidepressants? Yes or no? We have not got. Then what? Then what? Do you firmly believe that this girl is having depression? I would say no. I would say no. Now, this is the beauty of psychiatry, right? You might have features of depression, but you are not really having depression, but you are depressed. Was that understood? Depressed and depression is different, right? Sometimes when you have classes one after the other, back-to-back classes, you think, I'm fed up. I don't want to become a doctor. So many online classes. I don't want to eat. I feel like dying, right? Next day morning, you go to online classes again. What is that? Your mood was fixed. Your mood was fixed. If that is the case, it is not depression. But you were transiently depressed. For that depressed vela hitya, namut it is not depression. Was that understood? To say that it is depression, we have to have several criteria to be fulfilled. Right? There are several criteria to be fulfilled. Once you fill those criteria, then you will say depression. And for you to say that it is depression, these features should be there for a particular time period, right? It is a minimum of at least 2 weeks. Suppose you have all these features today, tomorrow you are enjoying, day after tomorrow you are getting the problem again, then it is not depression. Was that understood? Now, if you have depression and if you do not treat that, your girlfriend is having depression, your boyfriend is having depression, and you do not treat it, what will happen? What will happen? Yes, I think depression tibbama, if you do not treat, what will happen? Any comment? Yes. Okay, it will go into chronic depression. Depression, chronic depression, you know. Okay, it will be long lasting, fine. Now what? If you do not treat depression, now look at this girl. She thinks that it is not worth living. It is not worth living. What will happen? If you do not sort out this problem, she will end her life. She will end her life. We have heard in social media, actors, actresses kill themselves, suicide, right? And we say, okay, this is a mad person. He must be having this much of worth, money, this and that. Still he died, right? Poor fellow, right? Now what? And then he just broke up with his affair, and then he ended his life, right? How many affairs did I break, right? and I did not have any problem. This man is just dying. So we will be just criticizing. But why? Probably this person was having depression, right? Everyone who breaks their affair will not die, right? So this one is dying. So why is that? Everyone who runs 100 meters will not die. But if you have myocardial infarction, heart attack, when you run, you might die on the way. Why is that? Your heart is weak. So we'll have to give some drugs and make the heart strong rather than just bullying him. Now look at you. You can't just run 50 meters. You are dying. Whereas me, I can run. I don't die. Is it nice to bully myocardial infarction and say your performance is poor? No, we'll have to treat him. It's the same when the mentality is weak. When the mind is weak, they cannot tolerate even a simple thing. We can run 100 meters and then just stay as if nothing happened. But my grandfather will work on that event a lot. It's the same when you have a weak mind. When you have weak mind, your tolerance is very poor. You think rather than fighting, it's worth ending the life. When you end the life, what will happen? It's the end of your suffering. But what will happen to your family members? Your children, if you do not have children, what will happen to your parents? Is it worth losing a valuable person like you? So this is a medical student, 20 years old. This must be everything of their family, right? Now you are abroad and you failed one of the semester exams and died. What is the amount of suffering to your parents, right? They sold everything in their life, say the vehicles and lands, and the child was sent to Russia or China or Belarus or wherever. And now this man died. Now this man died. So is it worth preventing? Yes. How are you going to prevent? Treat the underlying problem. What is the problem here? This girl is very likely to be having depression. What depression? As long as you are having these symptoms for a long period of time, not just one-off events. If it is going on for more than like 2 weeks, if that is the case, this particular girl is having severe depression, right? Depression, there are diagnostic criteria that we will discuss when we do depression on a different day, right? Out of them, if you have several criteria, now this girl is feeling tired, it is one of the criteria, right? And then feeling to end her life, it's another criterion, right? And then she doesn't feel like having appetite, lack of enjoyment. If you have all those, likely that you are having severe depression. If you do not treat, what will happen? Next day, the child, this girl or this boy will jump from a high building and die. Was that understood? So managing depression is as equally important as managing myocardial infarction. They both will die due to different reasons. Was that understood? So this is one of the commonest conditions that you and me have, depression, and we are depressed. Now, when we are depressed, we'll have to treat that. If we do not treat, okay, they will die, right? That is the worst thing to happen. Plus, now this medical student, if you do not treat, what will happen, right? There will be several other things, right? They will have lack of desire to have sex. So if you are married and that age, not having sex abnormally will be a problem to continuation of the marriage, whether we like or not. Then the partner will have other extramarital relationships, right? Because you don't feel like having sex, right? And you don't have appetite. Then what happens? You might lose your weight, nutritional problems. So depression is depressed mind, but that will be manifested with other bodily symptoms and signs, right? The good thing is with proper counseling and proper drug therapy, the person will recover. After 2-3 weeks, she will be a different person. So that's the beauty, right? So that's the beauty of this condition, so depression. And when you are depressed, you don't feel like performing well in exams. Then what happens? You will fail next exam so badly than the current one. Then you will be more depressed. It's a vicious cycle, right? When you perform poor, you will feel depressed. When you are depressed, performance will even more poorer. Was that understood? So it's a vicious cycle. We'll have to break this at one point. How do you break? you might have to start non-medical management or medical management, right? So there are several ways how to manage depression, but we'll have to understand that this is such a common condition, right? Such a common condition. So we will write there, if you have the presentation, right? What is the likely diagnosis? Likely diagnosis. Likely diagnosis, right? She may be depressed. She may be depressed. Right? Or she might have depression. She might have depression. Right. So how do you figure out that? Yes, we'll have to take more information. Right? We'll have to take more information. Right? More information is needed. Our information only. Right? More information is needed. Then we will decide whether it is depression or depressed, and then we'll have to decide whether this is mild depression, moderate depression, or severe depression, right? What kind of depression this is should be known, right? So that we will discuss on a different day. Right now, with what is this? What is this? Yes. If you read this scenario carefully, yes. A 33-year-old man was referred to psychiatrist by ETU medical officer following a suicidal attempt. He's a father of 3 children, used to be a lottery seller, and lost his daily earning for last 2 weeks due to curfew, due to corona epidemic. Corona epidemic. Right. And he says that he was very sad that he could not provide food for his children, including milk powder for his 4-month-old baby for last few days. His wife has passed away due to a complication of childbirth, and his children are currently with grandparents who are also very poor. So what is the reason why he was presented to the doctor? Suicidal attempt. Suicidal attempt. So this is the problem. Suicidal attempt. So is it something serious? Yes or no? It's very serious. It's very serious. Tell me, is it serious? Tell me, Vijay Siri. Have you ever attempted to commit suicide? No. Right? No. But this man has tried to do that. Right? This man has tried to do that. Why do we do that? If you think that I can't fight anymore with my life problems, people might choose, okay, I should end my life. I should end my life. So this has occurred on this poor man, 33 years old man. So he has got into a position that I'm going to end my life. Right? So that's a serious problem. Right? What is the reason? He has lost his job. Right? You may have seen due to corona epidemic or something else, when you lose the job, how uncomfortable we are. Right? We can't feed children, their education, everything will be a problem. There are 2 ways to handle that. Some people will find an alternative. Find an alternative. For that, you have to have skills. What is that? When plan A is lost, when plan A is not there, we'll have to quickly switch to plan B, plan C. When you do not have that skill, this is the end result. Right? This is the end result. You will be just feeling sad, sad, sad. Go to some people and ask for money, loans. If that also does not work, you will commit suicide. Is it fair? Now look at that. He has 3 children. Who made these 3 children? Is that the nature God? No, it's this man. When you make children, we are responsible for our children. We can't just say, okay, I lost my job. You do whatever. I am going to live this life. That's unfair. That's unfair. Right? Although it is unfair, this man is having a serious problem. Right? Now suppose I'm having heart failure. I can't even get up. Right? And then my wife is telling, now look, Krishan, It's me or me and you who made these children. We'll have to feed them. You don't get up the chair. Get up from the chair. I am the only one who is suffering. Is it fair for her to say that? In a way fair, because I'm responsible for my children. In a way unfair. Why? Because I'm having heart failure. I can't get up. It's the same thing. You can blame on this man, fair, but we also should be sympathetic on this man because he is having a sick mind. His mind is sick. That is why he has tried to do that, not that he enjoy committing suicide, right? So we'll have to counsel this man and see what the alternative methods are. We can't just say, "Me mahatya, aina merendipa." No tivada karla tiyenne. So is that enough? No, it is not enough. We'll have to find out what the practical solutions are. Not just giving a pill is enough. Right? There's a particular method of counseling patients who attempted to commit suicide. However, this is one of the major topics in psychiatry. So there won't be any wonder for us to get 1 or 2 questions in ERPM paper related to suicide. Right. Now to have a small lateral discussion. Right. Which professions are at higher risk of committing suicide? Any comment? Who would commit suicide commonly? Manisha? Actors, okay. Actors, agreed. Bankers, doctors, businessmen, drug addicts, students, farmers, okay. Several professions are coming in the chat, but I would say, okay, one of the commonest professions is the healthcare workers. Healthcare workers. It could be a doctor, it could be a nurse, it could be whoever. Out of them, nurses, doctors, veterinary surgeons, and all, who is at the highest risk? MCQ. Who? Is that the doctor, nurse, or veterinary surgeon? Yes, MCQ. I'm not telling my own experience. I'm just telling what is there in Oxford psychiatry book. Out of these 3, commonest is veterinary surgeons. Veterinary surgeons, right? So they are staying with animals and several other concerns are there. However, veterinary surgeons. And then doctors and nurses, they have easy access to commit suicide, right? They have drugs, potassium chloride. If you just inject potassium chloride into your one of the veins, you will die, silently die, no pain. If you inject insulin to you, so you will get very low blood pressure, very low blood sugar. Next day in the sleep, you will die, right? And then there are other people who will commit suicide. One of the major categories is people with psychiatric conditions, mainly depression. If you are depressed, if you have schizophrenia, the chance of dying is higher. How to handle them is a different art, right? How to handle them is a different art, which takes 2 hours to explain that, but it's a separate session in psychiatry, right? It's a separate session in psychiatry. However, we will write there, right? We will write there, what is that? This is attempted suicide, right? Attempted suicide, right? Attempted suicide. Right? So how do you manage? Multidisciplinary. However, there is a place for counseling, right? And then they also will need the treatment for underlying psychiatric condition, maybe depression. Right. So that's about attempted suicide. Now we'll look at this patient. This is the 3rd patient who is coming to the clinic. Right. A 15-year-old girl says that she starts to sweat, feel her own heartbeat, and gets dry mouth when she remembers that she has to deliver a talk in school morning meeting. Right? Zamira? Zamira Lutfi? Have you ever felt that? Yes or not? Tomorrow I have to make a presentation, right? Make a presentation, do a presentation. And now you are feeling all this. So what is this? What is this? Yeah. What do you think that this 15 years old girl is having? Yeah. Several possibilities are coming in the chat, right? But very likely she is having anxiety. She is having anxiety. And some of you commented that it is social phobia. We never know whether it is social phobia, right? She is going to the society, right? When she is exposing to others, maybe she has social phobia, but we never know whether she has same phobia when she sees a cockroach, right? When she sees a rat. Do we have that problem? Do we get anxious and do we panic when we see a cockroach? It's a specific phobia, right? So we don't know whether this girl is having that as well. If you have all these, that's generalized anxiety. It's generalized. And generalized phobia. We don't know what that is. But what we know is, minimum what we know is, this girl is having some sort of psychiatric problem. What is this? She is anxious. She is anxious. Right now, do we have to treat this? Yes or no? Do we have that? Misuki, do you have this? Right? If you have anxiety, what is the nearest challenge? Viva exam. Viva exam, right? When examiner asks questions, you will start sweating. You will start sweating. You will start to have palpitations. You will feel that you are going to faint, right? Really, we get students who just go mute when we ask questions because their mouth is dry, can't talk at all. Now what happens? You will get poor, very poor performance or no performance. Anxiety per se will reduce your performance by more than 50%, right? If you are talking very well, answering very well at home, if you are anxious, when you go to the exam hall, you will forget more than 50% that you could remember. Was that understood? So is it important to read this? Yes, right? We never think that it's a problem. Instead, we think this is my nature. Then what happens? Because of this mage, right? You will fail Viva, right? You were supposed to become a house officer in 2021. Instead, it will be dragged to 2023. What is the pay? What is the compensation that you paid for your untreated anxiety? 2 years. 2 years of life was just dissolved for your anxiety. Aparadi. Next time you will go for Viva, again, you will perform poor. Does that mean that we have to give anxiolytics for you? Not really, but we'll have to make gradual exposure, right? So sometimes we say, okay, don't present don't present in front of me, but can you present in front of the mirror, right? Don't present, but at least, can you just unmute yourself? Zoom classes, unmute yourself. I'm going to pin karana, right? So everybody can see you. You don't have to talk anything. That's enough for today. Tomorrow, I will just pin you and ask you to give the introduction only. Then you will say, this 5-year-old child presented with difficulty in breathing. Enough. Ati. You will faint. Right? Now you are confident, right? Today I was taken by Krishan sir during Zoom meeting. Everybody saw me because my video was pinned. Still nobody laughed at me. So you will feel confident. And next day I could even talk, could give an introduction. Now next day if he asked, I'm going to talk a little more. Was that understood? So if you do not do that, what will happen? On the exam day, you will collapse. It's not worth, isn't it? right? And then psychiatrists will decide, no, this is not going to work. Gradual exposure per se is not enough. I am going to give a small dose of anxiolytic. Anxiolytic ekak. Say, I'm going to give a little bit of diazepam. Then in 1 week time, I will ask from Zamira, how do you feel now? Now she will say, sir, I will feel better now, right? I could give a talk. I don't sweat as much as I used to be, like in last 2 months before. Do you understand? Right? There's a method of treating this condition, right? What is the beauty? Understanding that this person is having this problem. Now, how many conditions did we discuss by now? Depression, suicidal ideas, and anxiety. If I ask, out of these 300 students, how many conditions do you already have out of 3? I would say everybody has minimum of 1. Several of us will have minimum of 2. Some of us will have all 3. Right? So is it important to know about this subject a little more? Right? Some students say, right, after learning psychiatry, now I am treating my own condition, not the drugs, but I know how to tackle with my problems. But anxiety manage karagan. So you told me the methods, I am using those. Now I feel better. My brother had the same. I'm treating him non-medically, non-pharmacologically. He also now feels better. I'm counseling him. This is such a practical subject, right? Such a practical subject. Now, you may have learned myocardial infarction. When your father gets myocardial infarction, do you treat him? No, we don't, right? We can't treat those conditions non-medically, right? But here, it's very easy, right? Very easy, right? So shall we write? What is this girl having? Anxiety. Anxiety. Right? He might also have phobia. We never know. Might have phobia. Don't know. Right? For that, we'll have to ask more and more questions. Right? We'll have to ask more and more questions. Right. Right. Okay. Now, could this be a medical condition? Could it be hyperthyroidism? Could it be hyperthyroidism? Is that possible? Here? Sweating? Dry mouth? When you have high thyroxine, can you sweat? Yes. But in hyperthyroidism, do you sweat only when you remember that I have to deliver a talk tomorrow? No. Right? So when you have hyperthyroidism, whether you have to make a talk or not, you will sweat. Right? Will you have palpitations of feeling your own heartbeat in hyperthyroidism when you feel that morning meeting? No, it will be there. Was that understood? Right? So that's medical conditions should be thought of, right? Medical conditions should be thought of, but it's unlikely in this context. Was that understood? So that's our third patient. We'll go to the fourth one in the clinic. Right. Right. So what is this? 35 years old man says that he can hear that his late grandfather talks with him. He also says that his wife is planning to poison him. Angara, what do you think? Yes. Have you ever heard your late grandfather talking to you? Grandfather? Siya kata කරනවා හිලා තියෙනවද? මැරිච්ච සියා? Yes or not? No, I think. No. Right? Have you ever felt that your mother is going to poison you? No. Father is going to poison you? No. Purnima, have you ever thought of that? No. No. Now this man is thinking. What do you think? What do you think? General a general comment is, you will say, this man is mad. Me manusayata pissu. Right? So what is the nice name given for pissu in psychiatry? Schizophrenia. Schizophrenia. Right? Schizophrenia. Schizophrenia is splitted mind. Mind is splitted. You are getting bizarre things. What is this? You are hearing that your late grandfather is talking to you. Right? If I hear that my wife is talking to me, I'm not at home today. Is it abnormal? It is. It is. There is no such stimulus, but I get some perception. No stimulus, but I get a perception. That is called a hallucination. Hallucination. What is this man having? He is having a hallucination. Was that understood? Hallucination. Right? There is no one in front of you, but you think that you see grandfather. There's no one talking to you, but you hear something. However much you say, no, Angara, you can't hear anything because there is no one around in your room. But she's telling, no, I am hearing. I'm seriously hearing. So what is that? It's a hallucination. Now the second one, I'm asking from Angara's mother, how are you feeling about your daughter? So she says, I love her a lot. She's my everything, right? And you ask from the neighbors, and neighbors are also telling, yes, that poor mother is treating her like a queen, like a princess. අනේ ඒ අම්මගේ වැඩේම ඔය ළමයාට සාතු සප්පායම් කරන එකම තමයි. ඇහැක් වගේ බලා ගන්න. So everybody is telling. But she is telling, no, she is going to poison me. Now what is that? It's a firm belief. It's a firm belief that she is having, but it's not the case. ඇත්තටම ඒක නෙවෙයි. But මෙයාට හිතෙනවා නෑ මෙහෙම කරනවම තමයි. Now that is called a delusion. What is that? It's a delusion. Was that understood? Delusion. Right? Now for it to be a delusion, the person should be firmly believing that, but it is not really the case. Plus, that belief cannot be explained with culture and social background of the person living. Right? Suppose Angara is Muslim and she thinks everything happens according to God's wish. දෙයියන්ට ඕන විදියට තමයි හැමදේම වෙන්නේ. අල්ලාට ඕන විදියට තමයි හැමදේම වෙන්නේ. ජීසස්ට ඕන විදියට තමයි හැමදේම වෙන්නේ. ලෝඩ් බුද්දාට ඕන විදියට තමයි හැමදේම වෙන්නේ. Right? What is that? That may not be the case. That may not be the case. But that is what she believes from her religion. That is what she believes from her culture. Then it is not a delusion. Then it is not a delusion. Right? Culturally unacceptable, socially unacceptable, but you are seriously thinking and you never want to reject that. කොච්චර වාද කරත් හරියන්නේ නැහැ. What is that? It's a delusion. Was that understood? It's a delusion. Right? Now I can see Purnima. Purnima has come to this Zoom session to learn psychiatry. But I firmly believe that Purnima has come to psychiatry session today to see what I am doing, where I am. Soon when psychiatry session is over, she will come to Premier and kill me. What is that? It's a delusion. It's a delusion. However, my Danushka says, no sir, me ahinsaka lamik. Pantiyata avilla inne. I don't believe. Danushka, are you mad? Danushka also must be planning to kill me with her. Now what is that? It's a delusion. Did you understand? Right? It's a delusion. Right? Has my society told that it's the case? Danushka doesn't believe. Other people are not believing. I am firmly believing. Has my religious leader told that it's the case? Zoom cameraවකින් ඔහම බලනවා නම් ඒ මරන්න තමයි කියලා. එහෙම කියලා නෑ. But I believe. So what's that? It's a delusion. Now, if you have delusions and hallucinations, probably I have schizophrenia. I might have schizophrenia. We'll have to have some more evidence to say that, but I seriously need to go to a doctor. දොස්තර කෙනෙක් ගාවට ගිහිල්ලා මට ලෙඩේට බෙහෙත දෙන්න වෙනවා. Otherwise what will happen? I might kill my wife. I strongly believe that she is going to poison me. It is not the case. Before she poisons me, I will kill her. Now see the disaster. See the disaster that could happen due to untreated this condition. And some people might have some other delusions. Some other delusions. Boyfriend is strongly thinking that girlfriend has another affair. However much you say, nah, ඔයාට තමයි මං ආදරේ. ඔයා මගේ එකම ලෝකේ ඔයා. Are you going to believe? You don't believe. එහෙම තමයි කියන්නේ. Right? කිව්වට මේ මනුස්සයාට තව relationship එකක් ඇති. Right? And the boyfriend thinks, right? My girlfriend is in my junior batch. She must be having a relationship with one of my juniors. So what do? Yeah, I will spy her lecture hall. Lecture hall එකට පස්සෙන් ගිහිල්ලා බලනවා. When she says that I want to go for shopping, I will stop all my work and see what she does. ඇත්තටම shopping දෙන්නේ නැත්නම් වෙන මොකක් හරි වෙන කොහේ හරි කවුරුත් එක්ක හරි යනවා. And when I get a chance to look into her phone, right? I think බලමු මොනවද message යවලා තියෙන්නේ. How the message කරලා තියෙන්නේ. Say you don't see any message, no suspicious message, then you would think, no, she must have deleted. She must have deleted. Now what? 1001 arguments. Then the affair will break. You might kill the other one, right? Now you may have seen in newspaper, the boyfriend has stabbed the girlfriend or girlfriend has poisoned the boyfriend, right? They are not just random events. There may be some underlying reason why they have done this. There is the problem in the mind, right? So it's very important to pinpoint those. So what is this? First concept is what? Hallucination. You can write there, Buddha. First concept is hallucination. Hallucination. Second one, wife is going to poison him is delusion. It's a delusion. We will learn all those later. However, understand that delusions and hallucinations. Right. If you have learned psychiatry a little in your medical school, delusions, hallucination, what is the other term that your lecturers described you? Illusions. There's another term called illusions. What is an illusion? Illusion කියන්නේ මොකක්ද? Illusion, there is an impulse, but you are interpreting it in a wrong way. Let me explain. Suppose there is a flag waving. There is a flag waving just next to Borella Cemetery. At 12 midnight, you go and see that it's a ghost. Holmanak. Miniyak mehada helluna, man දැක්ක ගමන් දිව්වා. Oh, මට සිහි නැති වුණා. Right? It is not really a man. It was a flag waving in the wind, and you think that it's not a flag, but it's a man. But that it's a false perception. Very correct, Charita. It's a false perception. Right? False perception. The flag is perceived by you as a man. Manussek විදියට තමයි ඒක පෙරුනේ. It's not really a man. Was that understood? It's an illusion. So if you have delusions and hallucination, this could be due to several psychiatric problems. One of the problems is schizophrenia. Schizophrenia can cause hallucinations, also delusions. Now, any other reason why you might get hallucinations? Any other reason why you might get hallucinations? You hear somebody is talking to you. You can see some people. Schizophrenia is one reason. Without any other reason why you might get hallucinations? Drugs, very correct. Some drugs, hallucinogens. There are some drugs, right? When you have those drugs, you will start to see people, some bizarre things. When we do illicit drugs, which is a separate chapter, right? Drug addicts would come, right? Drug addicts like interview, right? And then you will understand what their version about the story, right? What their version about the story. Let me see whether I can share a video. Please give me a second. psychoactive drug usage or drug abuse. I don't know whether you saw that. It's in WhatsApp group, right? It's in WhatsApp group. If you could not download that, please download that as well, because that is the presentation. Right. So if you are more prone to cigarette කරට පස්සේ ඔයා මොනවද ඊළඟට පාවිච්චි කරපු මේ drug එක? Ganja. Right. So he has started to have ganja, right? Junaid, can you hear? Can you hear patient's voice as well? Thumbs up. Right. Okay. Ganja. I am also going to talk in street words. Is that okay? Okay. So ganja. Otherwise, he will feel okay. Too official. This man is. Who is this? Right. So then ganja ගහන්න පටන් ගන්නකොට මේ වාට අවුරුදු කීයද? 19. So එතකොට මුලින්ම ගංජා කට්ටිය සෙට් වෙලා ඔක්කොම එකතු වෙලාද කිව්වේ? ඉස්කෝලේ කට්ටියම. So he started to have ganja with his friends and neighbors, right? With his friends and neighbors. Okay. එතකොට මේ දැන් ganja මම මේ පෙන්නුවොත් මේ doctors ලට, right? So you got to make ganja, right? So right. එතකොට දැන් මේ තියෙන්නේ මොකද ඇලෙක්ස්? දැන් මේ තමයි ganja මේ කුඩුනේ. ඔක පොලයක් වගේ දෙන්නේ නේද? ඔක දැන් මේ වේලපු පොලේ. Right. Video now. Right. Zamira, did you hear that I was interviewing a patient? Yes. Mohammed Naujad, did you hear? Yes or not? Yes. Now that is a patient who had who was having addiction to drugs. Some of those drugs, there is this video going on for more than 1.5 hours. It's an interview of a real patient, right? Interview of a real patient like that. So when we do different topics, we will interview those particular patients to get an understanding, right? Get an understanding. So this patient was having different drugs. Some drugs can cause hallucinations, right? Some drugs can cause hallucinations, right? So if a person comes and says that he sees something, we'll have to think whether that is due to an effect of drugs. Now look at this. Next patient. What do you see here? 25 years old. Right. 25 years old woman was brought to the A&E Accident and Emergency Department by her boyfriend. She has many superficial lacerations. Superficial cuts, right? Superficial cuts, right? And then on examination, right? Give me a second. On examination, there are many scars of old cuts in her forearm. She is also so distressed that she constantly says that her boyfriend is going to end the relationship. She denies trying to end her life. So what is this? Yes. Khalana, what is this person having? Yes. What is this person having? Any guess? 25 years old woman was brought to A&E by her boyfriend. She has many superficial lacerations. On examination, there were scars of old cuts. She thinks that her boyfriend is going to end the relationship. When you ask, are you going to end your life? She says no. එහෙම මට ජීවිතේ නැති කරගන්න ඕනේ නෑ ડોක්ටර්. ජීවිතේ නැති කරගන්න ඕනේ නෑ. Right? හැබැයි මට හිතෙනවා my boyfriend is going to end the relationship. Right? End the relationship. Right? So that's a worry. And she has several superficial cuts. Superficial cuts ගොඩක් තියෙනවා. Right? Superficial cuts ගොඩක් තියෙනවා. Right? So what is this girl having? What is this girl having? Any comment? Halana? What do you think? Yes. What do you think? Yes. What do you think? Yeah. What is she having? Now, this is called a personality disorder. This is a personality disorder. This is called what? Borderline personality disorder. What is that? Borderline personality disorder. Why do I say that it's a borderline personality disorder? Now, these girls are, if it happens in a boy, these boys are too dependent on the others. Too dependent on the others. So she will say, for everything, I want my boyfriend. To drop me to the class, I want boyfriend to come. To drop me to the house, again, I want my boyfriend. If I go shopping, I need boyfriend. That could be normal. But same time, she thinks that boyfriend is going to end this relationship, right? And to gain the attention, what she does is she has superficial cuts, right? Superficial cuts. But the unique feature in this condition is they never want to end their life. At the end, what happens is she will stop the relationship because there will be unnecessary arguments and with the boyfriend. She's always thinking, she's always telling, now, are you going to leave me? Now, phone eකට answer කරන්නේ නැහැ. දැන් මාව එපා වෙලාද? Right? I think that you are going to end the relationship. Right? She is deeply in love, but after around 3 months or 4 months, that affair is done. Then you will have another one. With that again, there will be deep love, but that again will end in few months. So dependent. So what is this? This is another condition, borderline personality disorder. This needs treatment. This needs treatment, right? Now someone will ask, now sir, everything that you say, I have all of those. I did not get any treatment. Nothing happened to me. මට කිසිම ප්‍රශ්නකුත් නැහැ. මට depression උත් තියෙනවා. What do you mean by කිසිම ප්‍රශ්නයක් නැහැ? You might live, you will not die. But what? The quality of life is poor. Quality of life is poor. We are always suspecting others. We are always against others. Always it's the jealousy. It's a sick mind, right? So it's nice to have treatment. Treatment doesn't mean that you have to swallow pills, but this will need some intervention. Was that understood? This will need some intervention, right? Otherwise, the quality of life is going to be poor, right? Now this one. A 30-year-old male was brought to follow-up clinic by the wife with abnormal behavior and reduced sleep for last 3 weeks. He has plans to open several businesses in many countries. Many countries. He says that he hears a voice saying that he can reduce the poverty in the world. He has drunk 2 bottles of alcohol 2 days ago. He has similar episodes 3 years ago. Upon further inquiry, wife told that he has few episodes of low mood with a suicidal attempt during last 3 years. Now see, plans of opening several businesses. Right? What else? Reduce sleep. He hears voices, depression or low mood. Right. If you put them together, what is this man having? What is this man having? Yes. Yes. Now his mind is fluctuating. His mind is fluctuating. Sometimes mind is so up, high mind. You think that I can reduce the poverty. But me lokema tiyena duppakama නැති කරන්න පුළුවන්. I am going to start several businesses in Australia, Russia, China, India, and Sri Lanka. Right? Too much. And then same time, you will feel depressed as well. So this is fluctuation of mind, up and down, up and down. If it is there, and if it meets criteria, this is called bipolar affective disorder. Bipolar. The mind goes to different poles, upwards and downwards. Upwards, it is mania. Upwards, it's mania. Downwards, it's depression. If you have the both, it's likely bipolar affective disorder. Bad. Bad. So when you get psychiatric questions, there will be minimum of 1 to 2 questions from bad, bipolar affective disorder. Right? We'll have to know how to manage them. What are the problems? Now this man is telling that he hears a voice. What is this? With our original principles, concepts, what is this, Buddha? Hears a voice. Hears a voice. Mukaddami. Yes. Hears a voice. Kata karanawa ahinawa. It's a hallucination. It's a hallucination. Hallucination. If I say that he thinks, right? He thinks that he can stop the poverty. Right? If he thinks that I can stop the poverty. Right? What is that? It's a delusion. Right? If you can hear it's a hallucination. Suppose I think that I can stop corona in Sri Lanka in 2 days. I firmly believe that I can stop corona in 2 days. What is that? It's a delusion. It's a delusion. Was that understood? These people can have delusions as well. What delusions? They think than what they can do. They are called grandiose delusions. Grandiose delusions. They think that I can stop the poverty. Right? Right? I can remember one of the patients in Peradeniya, when I was a medical student, he told that it's me who control the signals of dialogue tower in Hantana Mountain. You know Hantana Mountain? Hantana Mountain එකේ තියෙනවා dialogue tower එක. ඒකේ signals පාලනය කරන්නේ මම doctor. Right? If you are going to mess with me, I will stop all the dialogue signals. So you can't go to Facebook. Right? You can't go to Facebook. Right? So was that understood? So there may be, right? There may be several psychiatric features which could occur in bipolar affective disorder. They can have hallucinations. They can have delusions. Right? Several other problems could occur. Those we will discuss later. However, we'll have to write in the next slide. We will write that this patient is having bipolar affective disorder. Bipolar affective disorder. That. It needs treatment. Now what is this? What is this? A 15-year-old child was brought to emergency unit because of a fainting attack. She was found to have very low blood pressure and needed ICU care. Her mother mentioned that her daughter eats very little. Harima poddai kanne doctor meya. 1 biscuit per day. Dawasata biscuit ekai. Why is that? She thinks that she is already fat. Right? She has not attained menarche yet. She has not attained menarche yet. Examination revealed that she has dry skin, cold hands. Body weight is just 32. 32 weight is very low for a 15-year-old girl. Right? Height is fine. Right? So this is extremely thin girl. Yet she thinks that she is fat. Right? She thinks that she is fat. Right? She is fat. Right? She is fat. Right? So she is fat. She thinks that she is fat, but she is not really fat. Right? She is not really fat. And she doesn't want to eat or drink at all. She doesn't want to eat or drink at all. Because of that, she is very thin as well. Right? She is very thin as well. So what is this condition called? This is called anorexia nervosa. What is the name? Anorexia nervosa. Right? Have you ever felt that I am fat, so I should not eat a lot? We all feel that. We all feel that. But if you are thinking that you are very fat, even when you are not fat, that is the problem. That is what? That is the disordered self-image. You are not fat, but you think that I am fat. It's a mental disorder, right? I am not rich, but I firmly believe that I am rich. It's a psychiatric problem. Like that, I am not fat, but I think that I am fat, right? So what is that? It's a psychiatric disorder again. It's a psychiatric disorder, right? It's a psychiatric disorder. Now, when you have this kind of psychiatric disorder, this is called anorexia nervosa. Anorexia nervosa. So what's the danger? What's the danger of having anorexia nervosa? It has got several physical problems. What happens? This girl will get hypoglycemia, glucose aduino. Was that understood? Right? What is the condition? We will write Pudha. What is that? Anorexia nervosa. Anorexia nervosa. What are the problems? What are the problems? They can have low glucose. Glucose aduino. Glucose aduino. Right? Right? Glucose aduino. What else? When you don't drink, so you will be dehydrated. Shall we write? Dehydration. Dehydration. Right? Dehydration. Right? What else? It can cause problems in electrolytes. Your sodium level in blood will change. Potassium level in blood will change. Electrolyte problem. So what can happen? That can cause death. That can cause death. If you look at what happened to this girl, right? She was brought to emergency unit with a fainting attack, which means he has got a serious medical problem. If you do not manage this girl, she will die. Mary, right? Now see, if you do not manage a psychiatric problem, it is just counseling and doing bit of treatment for anorexia nervosa. Then we could have avoided this problem. Who get anorexia nervosa commonly? Kasuni Madara. Kasuni, who get anorexia nervosa? Yes, males or females? Commonly females. Not that males do not get it. Teen what? Teen girls. Teen girls commonly get that. A-level students, okay, that of course I don't know, right? Teen girls, right? Which professions would get that commonly? Actresses, correct, actresses. Who else? Modelers, athletes, ballet dancers, they all can get anorexia nervosa. However, you would say in kanda buddha, biscuit kala madine pute, no point, right? Because their mind is sick. However much you say that you are thin, they will say, no, I'm not thin. I'm fat. You want to make me more fat. Right? So that needs treatment, right? That needs one-to-one care. I can remember when I was in the UK for my training, there was this girl, 15 years, came with anorexia nervosa. When you give the plate of food, she pretends that she eats. What she does is, she just dump whatever food into the commode and flush it. Was that understood? Right? So that could happen. So there is a specific treatment method. Otherwise, this girl would die. Right? Otherwise, this girl would die. Right. So that is what? Anorexia nervosa. Right. Now, next one. A 3-year-old child was brought to hospital due to delayed speaking. He has poor eye contact and does not play with others. He only likes to play with a single toy. Is that normal? Is that normal? Yes. Sanka? Is that normal? Aisha? Yes. Is that normal? No, this is not normal. This is not normal, right? 3-year-old child not talking very well is problematic. This child is not only talking very, not only not talk very well, poor eye contact. In which conditions do you have poor eye contact? Bodhini? Poor eye contact? Yes, when you are not confident, you might have very poor eye contact. During Viva, when I ask, could you please present? No eye contact. What is that? Lack of confidence. And when you are anxious, anxiety, phobia, all those can cause poor eye contact. And this child, this condition is called what? Autism. AUTISM. Autism is a childhood psychiatric condition. Autism is a childhood psychiatric condition that can lead to serious problems. And they have poor speech, poor social interactions. That is why she doesn't want to look at you. Plus what? They have limited interests. They don't want to play with others, right? They will play with a single toy, right? They don't like to do any more things, right? They don't like to do any more things. So this condition is called autism, right? This condition is called autism. They don't like other people's company, right? They don't like other people's company. They just want, next slide, right? They just want to be single, right? So this condition is known as autism, right? This condition is known as autism. Right. Okay. Right. So that is autism. Right. Now, autism should be managed properly. Otherwise, child can get problems. Now, up to now, we have discussed several conditions. This one, if you say this one, if you see this one, right? This one. Right. So what is this? What is this? A 30-year-old male says that he does not have desire to have sex. He does not have desire to have sex. 30-year doesn't want to have sex. Could it be a problem? Yes, it could be a problem. It could be a problem, right? 40-year doesn't want to have sex. So this can cause marital problems, right? This can cause marital problems, right? So does it need treatment? Does it need counseling? Yes. To whom will they go? Will they come to pediatrician? Obviously no. To physician? No. Surgeon? No. Gynecologist? No. They will come to you as a person who knows psychiatry. Was that understood? So if you do not treat this condition, there will be marital problems, extramarital affairs, unnecessary problems, doubting, suicides, homicides, all those problems, right? Second one, a 30-year-old man says that he can't get satisfactory penile erectile dysfunction. To whom will they come? They also will come to a psychiatrist. Remember, disorders of sex is one of the commonest topics appearing in psychiatry paper. We'll have to know how to treat. A 25-year-old lady says that she gets severe pain in vagina during sexual intercourse. She says, I can't continue sexual intercourse with my partner because it pains, it hurts a lot, right? So that's again a disorder that needs treatment. There's a specific method to treat. A 20-year-old male says that she can't sustain sexual act with his partner for more than 5 minutes as he gets early ejaculation. So that's a problem. This is common in young people with their first sexual encounters. They are too excited. That can cause premature ejaculation before the partner is satisfied. So that's a problem. Where is the problem? The problem is not in the penis. Problem is in the brain. So they all need sex therapy. And then what? A 25-year female presents to psychiatrist as she does not get orgasmic disorders. Right? She says, I never get orgasm. Right? So that again is a problem. right? The male will think, okay, I can't satisfy her. Several problems, right? Several problems, but the real problem is in her mind, right? That needs treatment as well. And this one, and this one, right? Right. Now, we have discussed several topics up to now, right? We have gone through psychiatry, snapshots of psychiatry, but if I'm to show you the full schedule, it's this. It's this. Can you see this one? Right? So we do psychiatry over 8 days. It's an 8-day course to complete everything in psychiatry, right? So what is this? First, we'll have to know introduction to psychiatry. Introduction. There we discuss anxiety and OCD as well. What is OCD? Obsessive compulsive disorder. There's a condition called obsessive compulsive disorder. And then depression and suicide, they are linked together. If you are depressed, you might get suicidal idea as well, right? So they both are coming together. And then you have bipolar affective disorder and schizophrenia, right? And then eating disorder, sleeping disorder, sexual disorders, and then what? Dementia. You lose memory. Matakane. Dementia, delirium is another condition, right? Another condition. And then neuropsychiatric disorders are several. And then misuse of alcohol and other drugs. Misuse and alcohol and other drugs. This again is another topic. And personality disorders will be tested in the exam. Personality disorders and learning and behavioral problems. Autism comes under that condition. And then neuropharmacology, we'll have to know psychiatric antipsychotic drugs, their side effects, what to give, what not to give. And then psychiatric disorders in pregnancy and postpartum period, right? So that is as per Oxford textbook of psychiatry. Oxford textbook of psychiatry. This course was already done 2 times, right? 2 times. Over 900 students have already got their course completed, right? We will be doing this course again, right? For students who have not got this course before, right? It's done as a hybrid session where there will be 2.5 hours to 3 hours of recorded things, and remaining 1.5 hour or so, I will do the live teaching, right? If the question discussion and all, so that is how it happens, right? That is how it happens. Now, the students who are doing exam this time and then the other students, right? If you complete this one, right? So the one major subject in ERPM is done, right? And if you want to revise that again, when you go to 3rd year, 4th year, final year, your attendance is marked in the system any number of times, you can come again, right? So it's very important now, especially the students who are doing exam this time, we have just only 1 month, right? So that we will be starting the course on Saturday, right? We will be starting the course on Saturday, right? Saturday, 26th, right? We don't have time to waste. On 27th, right? 27th Saturday, we will be starting the course, right? And then within a matter of 3 weeks, everything is done. I will send the schedule later, but that is the case, right? This is the case. Right, now that's about an introduction. And if we go to this slide, what is this? Right. A 30-year-old lady says that she is sexually attracted to female, but does not like to have relationships with a male. 30 years. Dr. Mama females are tamai kamathi sexual, males are man kamathi naha. Yes. Is it a disorder? It is not considered as a serious problem. It is not considered as a psychiatric problem, right? Homosexual relationships are all fine. right? If you go to the ninth scenario, a 30-year-old male is having sexual relationships with a male. That again is fine. Homosexual, MCQ, which of following are disorders? Which of following are disorders? Homosexuality is not a disorder, right? Not a disorder, but cultural restrictions are there, right? When I was in the UK, I can remember some parents come, two women come with a child. Two women come with a child, adopted child, right? So they are living together. Ladies are then living together, and then this boy is also coming. We treat boy's condition, viral fever, whatever, and send home. We never ask, why do you want to have a relationship with this woman, right? And don't you want to have a relationship with a man? Is that our problem? That is not our problem. If you ask that problem, next day your GMC registration will be cancelled. With next available flight, you will be sent to Sri Lanka, right? That is not our business. That is not our business. But in Sri Lanka, if it happens, that will be the major topic in the town, right? Major topic. හැමෝම කතා කරන්න පටන් ගන්නවා nurses like doctors like අර බලන්න අර කොනේ ඇඳේ ඉන්නේ ගෑනු දෙන්නේ එකටලු ඉන්නේ, right? බලන්න අර ගෑණිගේ ලස්සන කොල්ලෙක් හොයාගන්න බැරුවද සමයක් නේද, right? So what is that? So that's the Sri Lankan culture, right? That's the Sri Lankan culture. So we'll have not only Sri Lankan, it's the typical Asian culture, right? We don't consider them as abnormal, but ethically or culturally, we are little reluctant to accept. And this next one, a 45-year-old man was brought by police as he had sex with a 10-year-old girl. He says that he only has sexual feeling towards children. Is that abnormal? Now this is abnormal. This is abnormal, right? Some people might have sexual polarization towards children as well, but this man is not having any polarization to anybody else but children. And it's a crime as well. Having sexual relationships with someone less than 16 years is illegal. Whether that girl likes or not, it is illegal. Kamathi unat natat, අවුරුදු 16ට වඩා අඩු නම් you can't have sex. There is nothing called consented sex. Less than 16 years, right? This man should be in jail by now, right? Why does he? Now, suppose this man was taken to the jail. මුලින්ම ඉතින් අපි මොකද්ද කරන්නේ? ජේල් එකට යවන්න කලින් ගමේ මිනිස්සු ටික එකතු වෙලා මේ මනුස්සයාට තඩි බානවා. Right? So that is the first thing to do, right? So you will punish this man. Then this will be in police custody. Then they will hit the man. Why is that? What is that? It is like myocardial infarction patient, and you are telling now doctor, I can't run. Duanda amarui. Now you are hitting. Duanda amarui. Hitabangu gahano. Is it going to work? No, we'll have to treat. Now this man is having this due to a psychiatric problem. Gahala wadak me. Was that understood? So it's a disorder of sex. He will need treatment, right? He will need treatment. No point of punishing this man. And what? Next one. A 39-year-old male was punished by people that he was unnecessarily touching a female while traveling in a bus. He was touching. Now what? Again, this will be a disaster, right? This will be a disaster. Somebody will punish, right? Gahana itin minisu ekatu wela. Gahala bus එකකින් එළියට දාලා තවත් පයින් එකක් ගහලා. What is that? It's a disorder. It's a disorder, right? It's a problem, right? We'll have to understand that it's a problem. All these are disorders of sex. Now what? A 30-year-old man having sexual relationship with a male. That is not considered as a disorder, but it is not socially accepted. Shall we write? Some of these are disorders of sex. Some of these are disorders of sex. They will need treatment. They will need treatment. Right. Any questions up to now? Dunidu? All good? Ramesh? Humila? All fine? Ayoma? Yes. Charita? Yes. All good? How do you think? Is psychiatry easier than pediatrics? Is it more interesting? Yes. 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 So this is interesting. Why? Why is that? You must be having one of these. We. Or your brother or sister or one of your relatives is having this. Or you have heard this. Right? Right? So we are familiar to this. Was that understood? So it is nothing to introduce. It's self-introductory. But it is just a matter of putting flesh and other important things into the already naturally existing skeleton. We all know this. හැමෝම දන්නවා. Everything is very familiar. දැන් මොකද්ද ප්‍රශ්නේ? දැන් මේකට බෙහෙත් දෙන්න ඕනේ. මොකද්ද බෙහෙත? බෙහෙත් වර්ග පහක් තියෙනවා. There are 5 types of drugs. What am I going to give? Now this person is having myocardial infarction. Then what is the best drug? Right? Some of the psychiatric drugs are not given when they have heart diseases, when they have diabetes. So that kind of fine tuning is needed. But we have an understanding what this condition is. Was that understood? So did you get a reasonable understanding? Thinking? Have I introduced the subject? Yes or not? Dilani? Yes, Samira? Is all fine? Right. So that's introduction to psychiatry, right? That's introduction to psychiatry. And then we'll see whether we can have another session during this week. Not sure. However, we will start the proper course on Saturday. And some of the students told, right, forget about these dates. In case if you miss one of those sessions, and that's the other news that I want to give you. Do you know that there is a software called Smartpedia? Are you already aware? Smartpedia, if you Google smartpedia.com, right? That's our software. You can download it and install it, right? In case if you miss 1 or 2 sessions, as long as you have registered, you can watch that at a separate time. Right? There are multiple time slots available in Smartpedia for registered students. The access will be given. Access will be there. I think you are already enjoying pediatrics through Smartpedia, but now you will get psychiatry as well. So forget about this timing. It was a problem in the history. That's no longer going to happen because we are having this software brand new as well. Right? So forget about timing. How to know timing? Yes, I will send you the document timing. I have spoken with all the teachers, so we'll make sure that things are not overlapping. In case if there is a very mild overlapping, that can be buffered with Smartpedia. Right. Okay, I don't think that we have any more questions. If you have, please WhatsApp me or call me. Right. So that's introduction to psychiatry. Right. So we'll stop this. Thank you very much for joining. Right. Have a great day.